My name's Nicole Voelker. I'm one of the charge nurses at Our Lady of the Lake Regional Medical Center. Working in the emergency department is definitely challenging. We get patients into triage into our department that we know nothing about. We get their story, their vital signs, and then we have to determine whether they're sick or if they're appropriate to wait in the waiting room. Sometimes we have 40 patients in our waiting room, and determining which patient goes into the one room we have available is incredibly challenging. There's always that fear that you choose the wrong patient or a sick patient gets overlooked because we didn't identify them appropriately or prioritize them appropriately when they came through triage initially. There's two groups of patients that I've seen have benefited from IntelliSep. The first group of patients is the ones in the waiting room. These patients can be overlooked sometimes. Maybe their heart rate's a little bit elevated, maybe their blood pressure's a little soft, but they're not floridly septic. We can't identify this patient sitting in front of us because they're not altered yet, they're not hypotensive yet, so they haven't become severely septic, which is easy to identify. So when they come back as a band 3, this patient is not going to be missed. The other patient that I feel it's helpful for is the patient that does come in severe shock, who maybe can't communicate with us, who is altered and hypotensive, and we're uncertain what kind of shock they're in. Are they in septic shock? Are they in cardiogenic shock? When we draw the IntelliSep and they come back as a band 1, we can understand that they're not in septic shock. They likely do not need antibiotics, and we need to focus on their heart and the cardiogenic shock that they're in. Whereas if that patient comes back as a band 3, we can understand that they do need blood cultures, they do need antibiotics, and we will probably be safe giving them the fluid boluses that they need. Before implementing IntelliSep, we had to manage the uncertainty of sepsis by over-ordering very large septic workups. We quickly realized IntelliSep saves us a lot of time. Since implementing IntelliSep, we now have a way to risk stratify these patients. As one of the charge nurses, it's incredibly helpful for me. It's allowing us to provide better, more accurate, truly patient-centered care.